Hi, everybody. I'm Olivia F. Scott, and welcome to Behind the Ad, where we meet with industry leaders who use marketing and advertising innovatively and effectively to equip you to do so as well. Today, we're talking about health literacy, community connection, and the power of communication with leaders of PR and communications from LCMC Health. We'll explore how they use marketing, media, and local presence to make healthcare feel more approachable and meaningful for the fine citizens of New Orleans. Joining me today from LCMC Health are Caroline Giepert and Corinne Stephens to talk about the powerful work they do to make health information clear, relatable, and accessible for our community here in New Orleans. Ladies, thank you for joining us. How you doing?
Good. Thanks for having us.
Wonderful.
Yes, thank you. We're so excited to be here. So thank you for this opportunity.
You're welcome. We know you have your own podcast, so thank you for coming over to our podcast.
Yeah.
So let's talk about health literacy. Will you help us understand how you all define health literacy?
Absolutely. So to us, health literacy really means talking to our patients, our community, in a way that they can truly understand. You know, we want to make it accessible and approachable because, of course, healthcare and health topics can be complex. So we are trying to kind of bridge that gap, and we hope that by communicating to our patients and community in this way, that they then feel empowered to make maybe better informed decisions for themselves, so that when they do go meet with their provider, we're kind of opening it up to be more of a two-way street, like a collaborative approach for them to work with their provider to find that treatment option that might be best for them. And so kind of by creating these broader public campaigns, again, it's informing patients on healthcare that might be directly affecting them, or maybe a condition that a loved one might have, so that when they go into that doctor's office, they know the questions they need to be asking, and again, they feel empowered to ask those questions, because sometimes there is kind of that, I don't know if I want to say like scary, it can be a little scary, and if you don't understand the issue or the condition, how are you going to understand how to make it better?
It's a very empathetic and thoughtful approach that LCMC Health has to health literacy. Can you tell us why, for the organization, it's so important that you actually do educate?
I would say really the end goal is always preventative and proactive care rather than what we sometimes call sick care. We would rather see you in our hospitals and our clinics when you're taking those steps to find out, rather than once you already might be sick.
Okay, we appreciate that. We appreciate your approach to healthcare in that way. So many don't do that, so thank you.
Yeah, I mean, I think too, it's just about making it so people understand. So, because I think a lot of people struggle to understand complex medical information. So just breaking it down for all of our community members is so important.
Okay, so many of us in New Orleans have seen the wonderful ads you guys have. You know, you guys do a really good job of using billboards, bus wraps, activations, and social media. Can you tell us how you decide which channels you guys are going to use media-wise to figure out the best reach and to resonate with the consumers here?
Yeah, well, you know, LCMC Health really prides itself on being community-minded. It drives our brand, and we want people to know that we're available to give them healthcare within the confines of the hospital, but also outside of it. And when we're thinking about media, like, that's just something that really drives us. So we want to align ourselves with organizations and trusted voices that can help us communicate that to the community. Like, I think a really good example of this is just what we've done for Mardi Gras.
Okay.
So during Mardi Gras, you would have seen us in billboards, on TV. You would have heard our radio spot, seen digital display ads, but we also partnered with the New Orleans Health Department to staff first aid tents across the parade route. So when you're out on the parade route, if you got hurt, you might have seen one of our healthcare workers. We also had the nursing pods from Toro. So if you're a nursing mother and you needed somewhere to nurse privately, we had those on the route. Additionally, you know, we also did Family Gras. So we were a sponsor for Family Gras, and we had first aid tents there as well. Okay. And really finally with the Heartbeat crew being on the parade route, celebrating with the community, So we're always just thinking about ways that we can meet people where they are.
That's it.
Yeah.
That's the name of the episode. I was going to say, you guys really do meet people where they are.
Yeah, and we do that with so many things. I mean, we have Crescent City Classic, French Quarter Fest. Again, we're doing first aid, and we have the nursing nest there.
Okay.
And we also really try to tap into different just activations like Heart Walk and NAMI. And we have the New Orleans East like mobile team that goes out and does healthcare screenings. So we really try to think about that as we're planning our campaigns.
I appreciate that. I think we all really appreciate that. I think as you were speaking, I go walk at the Joe Brown Park, and there's LCMC New Orleans East Hospital, right?
Yes.
And I always see them. They always have like a tent out there, just when I'm randomly walking and when there's activities there. So we appreciate you guys being there. Just, I'm walking on a random afternoon. I'll be going to walk this afternoon. So, all right. So speaking of that, when you're building campaigns like your Mardi Gras effort, which was so cute, I loved like the messaging around it. It was just so resonant with people here in New Orleans. How do you balance creativity, the community culture, and the health education? How do you make sure that you're like creating messages that really connect, but you're not going overboard? What's that process look like?
I think it's, it all kind of funnels up to the campaign goal and what our audience is in different channels. So I think the way that we balance that is that we think about where we are meeting certain people, and then we make sure to meet them there in different ways. So I would say that like when it comes to Mardi Gras specifically, we made people aware that we had the first aid tents, and that an ER was right down the street from a parade route. But we weren't, and we did some spots on the news segments about, how do Mardi Gras safety. So it's really about just, I think, comprehensively hitting all of those points in different ways throughout a campaign.
Yep.
Because, each platform and channel has the best delivery for those things, for sure.
So how do you determine which health messages need to be simplified or reframed so they're truly understandable and useful to the everyday person?
I would just say pretty much all health messages need to be reframed. Kind of like what I was referencing earlier, just like a stat that I think is staggering is 9 in 10 adults struggle to understand complex medical information.
Okay.
And I think that what that translates into is that when we're creating content, we really need to simplify things to the most understandable level so that anyone can understand their healthcare or feel welcome into the healthcare space. So for me, I think when it comes to copywriting, it's being objective, because a lot of people don't work in healthcare, so there's a lot of things that they don't understand just because they're not a part of that space. And even as someone who works in communications and marketing in healthcare, there's still a lot I feel like I'm learning, and I've been here for 3.5 years. So I really try to lean into kind of my training AP, like, wanting to make sure you write out an abbreviation before you say it. Like, I think a really good example of something that we've worked on recently is for Heart Month, we did a lot of work with our heart failure doctors and our transplant doctors, and the abbreviation LVAD came up, and and I was like, oh, I don't know what that means.
I don't know what it means. Then, right?
Yeah, and what it stands for is left ventricular assist devices.
Okay.
So that's basically what it is on a very, very small level. Is that it's a pump that pumps your heart when you have heart failure. So. That's the kind of thing that I think when you're inviting people into understanding healthcare, you have to make it simple for them to really get it.
Agreed. Agreed.
Yeah, I would say the other thing we approach is focusing in on those health topics that we know are most impacting our community. We know that we have higher than average rates of cardiovascular diseases here. We have higher than average rates of diabetes here. And again, these are things where people can, if they know how to mitigate those risks. I mean, of course, there's always going to be some genetics and maybe some biology that can't be prevented.
Correct.
But if we can break those down and inform our public on how to mitigate their risks, I mean, again, I think a perfect example that's very topical is May is Stroke Awareness Month. So
Which one?
Stroke Awareness
Oh, okay.
Month.
All right.
And New Orleans, unfortunately, exists in what's known as the stroke belt. So again, we have higher than national rates of stroke here. But what we can do is get our experts out there, whether that's through our local media or through our own channels, to talk about what's called Be Fast. It's an acronym to help teach and remind people how to recognize signs and symptoms of stroke and know that time is the most important thing when someone's having a stroke. So if you can recognize those signs and symptoms right off the bat and you can get them into a hospital quickly, you could save a life. And so it's really important that we do this education, but in a way that people can understand.
Really, really helpful to understand, like in New Orleans, what the specific areas of health concerns are, and then of course meeting our people where they are with that understanding. What does it look like behind the scenes when you're planning a campaign that feels non-clinical, relatable, and still medically credible? Can you give us a purview into those rooms or what it looks like when you're building those campaigns?
What we really appreciate is how collaboratively our team works. We have a beautiful team and everyone knows their roles very well and brings their expertise to the table. So when we're working on a campaign, we're probably meeting multiple times per week. And everyone is bringing in their own knowledge, their role, and they leave knowing exactly what they're in charge of and what they need to do. So we might have 5 different separate teams working on this campaign, but it comes through as one unified, beautiful campaign so that you might not even realize how many people, like you said in the background, we're working on it, because we always make sure we present a final cohesive campaign that you said resonates with our community.
Yeah, it all ladders up to whatever the campaign goal is and what the theme is.
Yeah, I figured, you know, having worked in advertising a long time and been in rooms where like creating things from the ether, I just wanted you all to share with others. Like, we see the end result, amazing billboards, amazing ads, amazing activations, but just wanted to get understanding what that looks like behind the scenes. So let's talk about Wake Up NOLA. Okay? So Wake Up NOLA has become a really recognizable example of LCMC showing up locally. Congratulations.
Thanks.
Okay. What makes a local media partnership or interview series successful for you all, and how do you use those platforms to educate the public?
I think Wake Up NOLA is a perfect example of digitally meeting people where they are. Because we're utilizing ways that people access content in their daily lives anyway. So that might be short form videos on social media or email newsletters. And so again, by kind of reaching them directly where they already are, it's a lot easier for people to get this information that they may need. And it sometimes might be relevant to a cultural event going on in the city, but LCMC Health's role always remains, you know, very natural and community focused, so that it is that natural partnership. I would say similarly, our Wellness Wednesday segments in that same vein are typically kind of short form, and it allows us to have our healthcare experts break down topics on nutrition, movement, managing chronic conditions, where to access your preventative screenings, what age you should get those, all information that the public needs to know. But again, just really breaking it down in a way that's easy for them to digest and understand, because the end goal is that they take that information and hopefully are encouraged to embrace their own wellness and lead healthy lives and do what they have to do for themselves.
How do you all know when a campaign is successful? How do you know when, like, you've hit the spot?
I mean, I think that really just comes down to like the metrics of what we're seeing, and it depends on the goal of the campaign, whether that's awareness or if that's driving appointments. So a lot of that, I think, is really what drives like whether we have success or not.
So tell me, for Wellness Wednesday, can you walk through that a little bit more? Tell us where we find Wellness Wednesdays. Talk about that a little bit more, and how do you know that's being successful? Because you're investing in that, we're seeing that a lot. So how do we know that's being successful?
I would say 2 parts for success outside of the metrics, like that kind of quantitative. I also think anecdotally. I like how you brought up our Mardi Gras campaign. I love when I see people around and they're like, oh yeah, I saw this LCMC Health thing related to blank. I thought that was so interesting, or I thought the billboard was so cute and fun. So just kind of that anecdotal. And then the really other part is going back to the quantitative. I remember I did a news segment with a specific type of surgeon. He said the morning after it aired, his office had received like 7 new calls of patients wanting to seek the type of treatment he provided. So sometimes we can have that real data showing our success. As far as the Wellness Wednesdays, I would say, because those, since they get run on online on NOLA.com, but also sometimes get picked up on social media, we could track that data of the engagement. And again, I think the goal for us always is we just want our community living healthy. So if we see that the community is approaching us, wants to come to our hospitals and clinics, or maybe is walking up to our tent at one of the events that we're at, to me that says we're doing our job.
So how do you think about being relatable when you're also communicating innovation, excellence, and performance in a campaign?
Yeah, I think that it's how we think about it is that, you know, everything, the whole point of a campaign is that you can build it to kind of say different messages on different channels. So to me, like what you're gonna say on a billboard, you really can only have a few sentences, right?
Right.
In a TV spot that's 15 seconds, there's only so much you can say, but you know, Caroline and I both work in a space where we have the ability to do more written, so like blogs, you know, we can use that to kind of communicate maybe more about that innovation or a sponsored news story. So I think the way we balance it is by making sure we have a good mixture of content, really, to communicate that thing. And you're thinking, you know, it takes 7 times for someone to really, you know, take an action after, you know, seeing your brand or seeing an ad. So, you know, the thought there is that they see a mixture of those messages in different places.
And what's the favorite part of what you guys do? What do you guys like doing the most? I know you have a background from LSU in advertising. And you, like, what do you guys enjoy doing with, what's the biggest part? Like the writing part of it, the creating the ads, just what do you enjoy most?
Do you want me to go first?
You go first.
I think for me, I just love the challenge of communicating in a way that resonates with people, and tells a story, right? There's so many amazing things that our healthcare teams are doing, and I love being just one piece in that cog to tell that story. And that's what really like drives me and just makes me excited to get up in the morning and be at LCMC Health, is that like we're doing great things. Yeah. And
you're saving the world, literally, through your work, because you're educating, health education and literacy.
Well, and we know, like, just the people that work at LCMC Health, they really are doing such great work, and it's like I want to share that with people. Yeah. And I feel like that's our job.
Yeah, it's a good job.
I pretty much echo all that sentiment. I would say, yeah, my favorite is telling the stories, and sometimes that might be the stories of our experts. Maybe they might be doing the first type of procedure in the state of Louisiana. So I love when we can tell that story of innovation and cutting edge and show that we really are, we're right there. But also aligned with that is our patients. I have been so fortunate to work with some of our amazing patients and share their story, because they maybe had, you know, it could have been a scary experience, but at the same time, they're grateful to LCMC Health for helping walk them through that. So they want to share with their fellow peers out in the community that, hey, I went through this, but LCMC Health helped me get through it. If you're experiencing something similar, you might want to seek this care too.
Cool. And then a couple of last questions. What's your favorite campaign?
Favorite campaign LCMC Health has ever done?
Yes.
Okay, I know I've talked a lot about Mardi Gras, but I love Mardi Gras. And also, I think if you're gonna say a piece of the campaign, I love the radio spot.
Okay.
I think it's just so catchy, and I just don't think there's anything like it.
Okay.
And I feel like that's what I hear so much feedback on. I didn't have a hand in creating that. That was all our senior creative director, but
Jason.
He's actually been on the show.
Yeah, Jason noticed.
Yeah,
okay.
that was all Jason, but that's just like one of my favorite things that we've created.
Thank you.
Since you said Mardi Gras, I'm gonna pivot, because of course I love Mardi Gras. Like, as a native New Orleanian, it's my favorite time of year, and so now being able to bridge my personal love for Mardi Gras with my professional work, that's always been fun. I will say Donate Life Month. It's April. LCMC Health works closely with the Louisiana Organ Procurement Agency. And so throughout the whole month of April, their organization is always doing so many different events and activities, whether it's a flag raising ceremony to honor donor lives, or maybe a butterfly release. But I've worked with their team to connect with, again, some patients or some relatives of donors who have lost their lives, but then went on to save lives through organ donation. And it's always just so beautiful talking with these people and hearing the impact. And again, then using that to tell the community, because I think there are, of course, some concerns and some misconceptions about organ donation. And I think it's very important to let people know that it is safe, it's good to be an organ donor because you can save so many lives.
Okay. So for any students watching, and they're just like, ooh, when I grow up, when I graduate, I want to be just like Caroline and Corinne, right? What skill sets do you think they need? What do you use?
I would say very strong writer.
Okay.
So I will very briefly go into, I did not study communications. I have never taken a single communications class in my life.
All right.
My background is I have my master's in art history, but with art history, you have to do a lot of analyzing, research, and writing. So I've always been a very strong writer.
Okay.
And then also that creativity. You need to have a creative spark because when you're creating campaigns, and I think a lot of, on a more personal skill set, yes, a lot of empathy, a lot of understanding of what's going on around you, what's going on in the real world, what's impacting people, what is your community concerned about in today's world?
Yeah, you gotta really care, because it sounds like you guys really do care.
Yeah.
Yeah.
Well, I love that. I definitely agree with the writing foundation. I feel like even in the beginning of my career, that's something I've really had to work on. So I think that's like such an important thing because it's like kind of the basis of everything is writing. Then I would say like internships. Like I think that, I mean, look, you learn so much in the classroom, but you need to take those principles and actually put them to work.
Students listen.
So I just highly recommend internships. I feel like it was so formative too in deciding what I wanted to do, right? Because in advertising, marketing, and communications, there's so many avenues you can take. And really, I think the best way to know if you want to do something is to do it. So,
Correct. I figured that out myself very early on. So lastly, right, in a crowded healthcare market, I think we've addressed this already, but I just want to get it on the record because I think I have an answer for it. But in a crowded healthcare market, what do you think LCMC does exceptionally well that helps you stand out from other health organizations in the region?
Do you want to go first?
I'll go first.
Okay.
I think it is, like you said, all of what we've already been discussing.
Right.
That humanization, that human aspect, and just connecting with people. One of the things I had discussed with Corinne to bring up is our what we call little extra videos. So that's something that we have our physicians, nurses, nurse practitioners film little short form videos that then live on their provider page on the LCMC Health website. And the little extra is, what do you do outside of work? What's like your fun hobby, or what's like a fun fact about you? What do you enjoy doing? And I think that really helps people see their providers as people.
Yes.
Not just the expert, not just the scientist or the doctor, and maybe helps them feel more comfortable approaching them.
I appreciate that.
Yeah.
Yeah.
I mean, I think that's like a huge thing. And kind of in that same vein is just, I think, the LCMC Health brand as a whole. You know, it's the way it looks. Like, you don't really see a lot of healthcare brands that have like teal and a light blue
Correct.
and a lime green.
Yes.
So it stands out visually.
Yes.
But it's also that it has just the heart and soul, you know, and that's what we talk about a lot. It goes there's a little bit extra, and that lanyap. So it has the New Orleans thing, and it really wants to. It's a part of this community, and I think that's what makes it so stand out.
We are so glad you guys are here and are a part of the community. I mean, I think that's why I invited you guys here. LCMC Health really does speak to the heart and soul of New Orleans. So thank you all for doing the work you do and for being here today. This conversation reminds us that health literacy is one of the most powerful tools we can offer a community. We really applaud LCMC because when healthcare communication is clear, thoughtful, and culturally grounded, it does more than inform. It empowers and it saves lives. So thank you to Caroline and Corinne for making time out of their very busy schedules today to join us to discuss the important work that they do. And thank you for listening. If today's conversation sparked something in you, an idea, a question, a sense of what your own path might look like, I invite you to keep following these stories with us by subscribing to our Loyola University School of Communication and Design YouTube and Instagram. As always, I'm Olivia F. Scott. Thank you so much for joining us today, and we'll see you on the next episode of Behind the Ad.